Hi guys, Dr. Amy Crane here from Inver Chiropractic, and today I want to talk to you guys about neck pain. Neck pain is a super common condition we see in our office, and statistics show that over a 3-month span of time, at least 15% of the population will have some form of neck pain. And of that, 30% of those neck pain issues turn into chronic neck pain issues. So we see a lot of people for neck pain, neck injuries. So there's numerous different reasons why we can have neck pain. We can have it from arthritis, degeneration, structural changes, posture issues, traumas such as car accidents, slip falls, all these different things. So what we do in our office is we first start out with a thorough history and examination, that we look into all of these things, see what could be contributing to these issues. And a big part of that is x-rays. So we love using x-rays in our office. They're safe. The former radiation is so slim with the new digital x-rays and the new technology with that. But on x-rays we can see so much more, which allows us to get really specific with the root cause of why we're having these neck issues, and then also specific with what treatment that patient would possibly need. So on an x-ray there's a lot of things that we look for, but we look for a lot of structural misalignment. So we want the vertebrae to be in as much in alignment as we can without any rotation, no lateral bending, things like that are going to put pressure on the nervous system here. We want to remove all that interference. So we can see that on x-ray. We also look at disc spaces. So if we look at this poster, we can see these spaces in between the bones. Those are our discs. Those are shock absorber and compression. They take compression off the bones in the spine. So we want those thick and healthy. So we can see that spacing, make sure it's adequate and healthy, because that's what's going to take pressure off of the bones and reduce that arthritis. So we can see in this picture here where some of that disc spacing has been decreased. That can create neck discomfort. Another thing is we want a nice C-shaped curve through that neck. Why? Is because we need these curves in our spine to also absorb compression force. So if we lose that curve, naturally our head is going to shift forward and down, and we're going to add more stress to this neck and the vertebrae. But then also these muscles back here are constantly, I think about, pulled under tension like a rubber band. They're really tight, trying to hold that now heavy head up. So that creates a lot of tension, stress, and pain in that neck. So we look for structural changes like that could lead to that arthritis and more of that permanent change. But yeah, there's lots of things that we can see on x-ray. Unfortunately, sometimes we catch things that we don't think we would. Maybe you have a condition you didn't know about, or something you were born with you didn't know about, possibly cancer. So for us, we always like to see x-rays before we treat a patient, just to make sure that everything structurally looks good. Chiropractic is a safe treatment option for them, and make sure that we don't need to refer them to anybody else. So it can get us specific with treatment. It just shows us so much more and lets us diagnose and figure out that root cause of that neck pain. So if you guys have any questions regarding anything I talked about, please comment below, and we'll get back to you as soon as we can with any questions. If you felt like this was helpful or informative, please like and share this video with others. Thank you guys. Have a great day.